This has been a great discussion. I think we're super excited about the direction this field is going, the opportunities in this frontline space that are evolving with combinations with immunotherapy. The response rates seem to be going up and up. The progression-free survival seems to be getting longer and longer. Tolerance seems to be no worse than what we've seen. It's an exciting time, and I'm optimistic we're going to see further advances in our field. I'd like to just end with a few closing remarks from each of you. And, you know, Neeraj, we started with you. Why don't you start us with some final thoughts?
This is really embarrassment of riches now, especially after moving forward 2 years from now. We like 5 different combinations, immuno, VEGF, immuno, maybe other ones will kick in, epocadostat with pembro, maybe that will be approved. I think the most important and most pressing issue for us would be at that time, or even now, is to look for biomarkers of response, to select patients who are going to respond and also who are not going to respond, to save on cost and toxicities. So I think it's very exciting overall, but I think that's the most important issue now. Instead of just blindly picking up drugs and, you know, randomizing them in clinical trials, I think we need to go towards picking up patients based on underlying biomarkers.
Bob, from the community, thoughts?
I couldn't agree more. You know, despite the fact that we're just in a small community, we do have accessibility through our pathologists and the lab means to definitely come up with these biomarkers. I think precision medicine is really meant to now allow us now to try to find the right drug for the right patient at the right time. And I think that if we can do that, our ultimate goal is patient care, quality of life, and survival. And I think we may be able to do that soon enough.
Brad?
Yeah, I mean, I 100% agree with biomarkers. And I think what's most encouraging to me as we start to look at all these new data is just the CR rates that we're seeing, were something we never saw before. And, you know, we tend to think, you know, I meet a patient and say, hey, you have disease, my goal is to treat you, I can't cure you, but maybe that's not going to be the case. And maybe with these new therapies, we're really going to get these long-term durable responses. So I think these combinations are definitely going to be intriguing going forward.
And Nick?
Well, I think we're going to see more advances. We're not done yet. You know, the triple combinations of Nivo, Ipi, Cabo, people are going to push the envelope. And the IDO inhibitors, the adenosine inhibitors, it may well be that in 2 years we're going to be talking about an IO, a TKI, and enhancing that TKI or enhancing that IO. So I'm looking forward to the next 5 years. We're going to have 3 drug regimens that may well cure patients regularly.
And I think this is one of, I think, the key points for, you know, educational sessions like this and for, you know, the meetings that we have at GU, ASCO. This is a field you need to stay up with. Kidney cancer is going to continue to evolve. We have more therapies than ever, but we also have new combinations and iterations of these. We have opportunities to get to no evidence of disease. In the adjuvant setting, we have an opportunity to treat now and keep patients from relapsing. We have clinical trials in that setting. We're going to need community participants to help us to get those studies done. In the frontline setting, now you're going to see changes over the course of this year evolving and into next year and probably the year after that. And staying up with that, being early adapters, being open to trying new paradigms and approaches, looking for new endpoints, including trying to get to complete response. I think these are all the kinds of things that, you know, up until very recently, we haven't had the tools to really, you know, hope for this outside of the few exceptional responders. Now these are becoming 10, 15% of the results in our clinical trials. Now these are legitimate endpoints that we can be shooting for. So our field is changing. It's more hope than ever. It's still daunting to take care of these aggressive cases that don't respond. But more and more, I think we're seeing this disease become chronic and manageable. And you know, the more you can stay up with this with your patients or collaborate with your local academic centers on tumor boards and whatnot, I think the more likely you're going to see better results in your practice.